started, but here we go. So, because it's all about sexually transmitted diseases, and these are some bad ones, and it's difficult. Here's my degree of difficulty. I, the classes I teach are all you and your age, with rare exceptions, and I'm getting a whole lot older than you are. Okay, and as I progressively get older, I'm farther, and it's maybe it's I don't know if it's easier to hear me talk about it from someone from years ago as compared to what's going on today. But I mean, I have to inform you of what's out there, and it's not like it's changed dramatically. It's always been out there. It's just it's social, in this case, social sexual interactions have certainly changed over the years, and it's so I mean it's hard for me to add that into this picture here. And there's some disturbing pictures that are part of this that you'll see coming up because I mean, and for many of you, since most of you are going into a nursing field, get used to it. It ain't pretty out there. Okay, it'll shock you. So I mean, maybe that I don't know if that's a good frame or not, but to take it for what it is, I can't even tell you how many times I've taught this when we're starting. Years ago, what I put on the board, not that you have to know about this, is we used to everything was a frame of gonorrhea. But still here, still nasty, awful. But really, in the old days, we either called it gonococcal urethritis or non-gonorrhea. Either it was gonorrhea or not. We didn't even know about chlamydia or trichomonas. It's just that they weren't gonorrhea. And gonorrhea was that severe and it was that prevalent and it was being addressed constantly. You might remember me talking about metals when we talked about silver and the use of silver nitrate. And that's now they use antibiotic drops for years, for a long time, up until maybe the last 25 years, they would put silver nitrate drops around the eyes passing through the birth canal because the gonorrhea was everywhere. And because it's a nasty bacteria that attaches to everything so easily, it led to multiple cases of blindness in children. And the poor baby's eyes would be black, and moms and dads would spaz out. It's a little bit different today. Nevertheless, here we go. And the recurrent theme, and I don't necessarily agree with their numbers, is because I think men are consistently more symptomatic. Men are just less likely to do something about it. Would be the way, and I mentioned this to you before. So signs and symptoms for all of these are about the same. It's a discharge. It's much more, to me, it's much more obvious about the discharge in men than it is in women necessarily. Okay, but the big problem is really here, that number. 75% of women are consistently asymptomatic. And that's true for most of these until they get more serious and eventually work their way up into the tubes toward the ovaries. You get pelvic inflammatory disease, and all of these kind of end the same way. The difference is, at least we have for all three of the ones I'm going to go over here, chlamydia, gonorrhea, and trichomonas vaginalis, which may not get to exactly in that same order, but the first two certainly will. They are treatable. Maybe we see with gonorrhea, it's been around for so long, it's becoming, we're experiencing more resistance. But that's sort of the jumping off frame. And so, and this is the idea. A lot of these don't appear. It's not like they wake up the next morning and something's going on. There's a certain amount of time in between. And again, all my frame of reference is when I was your age thing, and maybe maybe a tad older, early 20s, and out of college and going to medical school, and it's a very different time because we hadn't heard of HIV. I mean, again, it was the doctor will fix you up type of thing, and it was casual sex and one night stands and minimal use of any type of protective methods. You get the idea. Okay, and it really was so different what was going on then that are there, and I would think it's dramatically different today than it was then. I would certainly be optimistically hopeful for that. Nevertheless, so it takes a certain amount of time, and imagine then when people have additional contacts, effectively, it doesn't, you don't, at that point, you're still able to pass these things around. It doesn't take long. So In the male, maybe or not, they notice it. They should. Okay, I think it's more symptomatic than they would let on. I would say at the very least the numbers would be 75% of women might be asymptomatic, but men, I would think 75% would be symptomatic from these types of things. Pain on urination again, frequency, urgency, irritation, all of those things. And again, the same things here would apply, and we're beginning to look at discharge, and certainly bleeding you would think would get someone's attention, as well as all of these things, particularly, painful areas of intercourse that were going on. This is another one. It's the same deal. What we're seeing more problems with eyes, and this is why prenatal care is so important and being aware of it, and why it's still mandatory in any child born in the United States, and I would hope worldwide, but I'd be naive to think that was true, that you have to use some type of antibiotic drops, because all of these can cause things like pneumonia. Well, I mean, there's chlamydial pneumonia, there's chlamydial, what they call trachomas. These are the trachoma or trachom, it's where it kind of gets its name. They are particularly eye, and they can yield blindness and really significant visual defects that occur in the child, again, as it passes through the birth canal. There's some oddball ones that cause, these are very unusual, these enlarged lymph nodes in the groin. I've never seen one. In general, these are much more common in tropical areas in general, and more common in what we refer to today as sex workers. And it's just, and they're particularly in an area where these folks, because of what they do, really don't get checked on. It's not a control type of thing. At least in Nevada, with the legalization of prostitution, which has been around for a long time, at least there's medical checks that go on regularly. Just how efficient those are, I have no firsthand knowledge of any of that type of stuff, to be completely transparent about it. And all of this, lymph vessels, extreme swelling, this is what some of this, I've just never seen any of these. We've seen plenty of these, but in our day and age, we just either classify them as it was a gonorrhea or not. And we almost treated all of them similarly. This is what I mean by a trachoma. Really had to do with the eye and giving the illusion that as though, I mean, this child would probably not see. And many times, unfortunately, that was it. It's a gram negative. We didn't know what that was. It has two forms. I will not ask you about these. I mean, but I would keep in mind the words elementary body and reticulate body. Those are the things when you're talking about licensure exams that might come up. Okay. I always like to warn you because people like to identify them. But this is the part that's transmitted. They'll show you the life cycle. There's lots of different subtypes of these. That lymphogranuloma venereum is relatively rare. The trachoma, that eye infection that leads to blindness. And that's why I had a student, maybe I told you, I was over at CCAC, and you have a lot of non-traditional students. And this gal, going into the nursing program, worked in an OBGYN office in Fox Chapel. Fox Chapel is a very affluent community. Well, no one would ever, have pregnant and not get regular checkups before. And I'm like, maybe not in Fox Chapel, but go into the real world, and you might find that out. Okay, in the emergency room, I can remember 2, if not 3 occasions in my years there. I remember my first wife was first the assistant head nurse and then the head nurse of that ER, where we had girls coming in who with stomach problems because they gained a lot of weight and didn't tell mom and dad, and guess what? They were crowning. Delivered in the ER, no prenatal care. Hello. So don't be so terribly shocked that those types of things happen. Absolutely true. I don't pay a lot of attention, but this is what happens to it. Okay, whatever the cells are, and they're typically lining cells, mucosal cells, the elementary body infects it, it stays inside in this, it multiplies in this, and then as the cell kind of dies, more of them come out. If you're interested in that, I'm not. And exactly how that it can present, it avoids host defenses, which is really significant. The damage is largely, again, interesting. This is the difference between direct and indirect. This is indirect through the immune system. All the bad things that can happen, very unpleasant. And all of these in the male, you get to the point where now you're dealing with potentially, the longer it goes not so much untreated, I would say, rather than unrecognized. I mean, and that's where the responsibility comes in without getting too preachy. I mean, if you're going to have this lifestyle, get yourself checked on a regular basis. I mean, I'm not. You're going to. I've learned in life, people are going to do what they're going to do, if nothing else. And again, this is the same for men and women. It's problematic. Fortunately, it's not. I mean, it's something we can still treat. That means it's notifiable. So they have been rising. Okay, and that's more because of this than anything else. People are more aware of it. They're getting it checked, and then we're able to identify that antibiotics for the partners, and there could be many. That's the interesting part about that, trying to get a history. If it's notifiable, then the health department has the less than pleasant chore of knocking on doors and trying to interview people who have contacts and then their contacts and so on. That's how you track these down. It's good old detective work, and it's not easy. And basically, they're trying to find out, to try to address this so people can be treated. It's confidential, but people view that as being invasive. And unfortunately, particularly in today's environment, when someone with an authority from an agency comes knocking on the door, people respond at times unpleasantly. Just look at the news. Okay, all people who are active get tested each year, twice yearly. Particularly in the try to get as much information as possible. I'm trying to do this in a polite way. I'm trying to. It's not easy for me either. And they're going to tell you the same thing. Fortunately, this is not a cell wall. They don't work. The Z-Pak, Vibromycin work very effectively. It's not cell wall antibiotics. Okay, they're going to tell you about the whole thing: abstinence, monogamous relationship, condoms, other barriers, blah blah blah. Easy to write down in print, hard to happen in real life. Might be the way. So I mean, there's adequate treatment. Here's one of those troubling pictures. That's gonorrhea. A lot of people had that. And typically it's very much of a pustulant or a purulent discharge, and very much, typically it has more of a yellowish kind of a quality. This is a very interesting bug called Neisseria gonorrhea. So I'll get off this picture in a second. Relatively short incubation period. It is not frequently asymptomatic. I don't know who's talking to you, PowerPoint writer. This sucker hurts. That's why we see less of it, because people are getting it treated. And of all of these, this probably has the most severe complications. Pain, thick pus. It firms up, and so when they attempt to initiate the stream, particularly in the morning, it's almost like a cork popping. I hate to be so graphic. Very, very significant. This was the vast majority of the PID cases we saw as residents these 50 years ago were about this. Obstructions, all this, abscesses, orchitis, which is inflammation of the testicles, infertility, etc. Happy to get off that screen. In women, PID, perhaps carried by sperm cells. That's interesting. Any of these, when it gets in pelvic inflammatory disease, again, the same things occur. And those same things are ectopic pregnancies, damage to the ovaries, infertility, early hysterectomies, all bad. And because of the disconnect, the ovarian anatomy, where there's an opening directly into the abdominal cavity, let's be clear, this is anatomical, you can lead to full-blown peritonitis and be in a life. These are, by their very nature, potentially all life-threatening. All of those things. And when it disseminates, it spreads easily. And the interesting thing about gonorrhea is that it tends, when it does damage, it gets into the bloodstream. And in the bloodstream, it can attach in really interesting, unpleasant places. And even, this is the part where I have to be a little more graphic. First, if you see an adult and they test them, and then they come in with a big swollen knee or some other joint that's red and inflamed, and let's say somebody's there and they aspirate it, and out comes pus, and they test it, and then in the test you see gram-negative cocci in pairs. that's gonorrhea until proven otherwise. Any pustular drainage in an adult from anywhere, there is a history of trauma. It's not like, oh, I fell down and something sharp in the grass got me and made a cut and they're okay. But if there's no history of trauma in that area, they got gonorrhea. It targets. It's the leading cause of septic arthritis in other than in children. In little kids, remember those growth plates and things like that. The whole idea is it's able to get. In children, I had a case where we had septic arthritis in a little kid, and it was very interesting because they didn't have any insurance. And between their family doctor and I, we figured out, and a very cooperative mom and a very good 6-year-old, we were able to treat this kid successfully without having to hospitalize them. Very successfully. So there's a very interesting case. And again, this is, that was not obvious. That was a staphylococcal infection, it turned out, which is the more common agent. But in an adult, it is gonorrhea. And depending, forgive me, whatever, as my daughter would say, whatever floats your boat. Whatever type of activity one would have, if it's gonorrhea, it can attach there. You get the idea? Wherever it goes, it can attach to structures all over the body. It's got those neat little fimbriae, and they just latch onto it. So you can imagine the scenarios without me describing them, because I'm not comfortable, as you can tell, describing them. But they get into the bloodstream endocarditis. The leading cause of meningitis in adults is called Neisseria meningitidis. Same family name. Okay? Neonatal conjunctivitis, very significant, and blindness. Gram-negative. You can see those gram-negative diplococci. There are those nasty fimbriae. Very fastidious. The good thing about chlamydia and the good thing about gonorrhea is they don't survive very well outside the body at all. So they don't survive well on surfaces and things like that. So it's not something you could passively transmit if it's on a surface that you might come in contact with. At least that's the good news about all of this. So the pili attach. Notice all the areas that are there. You get the idea. Linings cannot attach squamous epithelium such as the lining of the adult vagina or ciliated cells, but a whole lot of other areas. Non-ciliated columnar mucosal cells is where they, and there's a ton of those in all of these areas. Okay, and then it goes on. It's an intense inflammatory response without going crazy. Lots of cytokines. Those are the chemicals that circulate. All of these types of things occur. And you can see even the peptidoglycan that's part of them, even though they're gram-negative, toxic to those ciliated epithelial cells. So you can imagine the mechanisms that is damaging. Okay, look at all of this. This is why it's so difficult, and it's been around since biblical times. This is nothing new. Understand that people did not understand until the more modern age how could something like sexual intercourse, which is normal if you want to have kids and pleasurable even if you don't want to have kids, how could something that's a natural phenomena be so dangerous? They didn't understand how easy it was to spread disease. They just didn't. It didn't compute. Why should I start doing that? Because that makes no sense. Well, and eventually, Pasteur, germ theory, you got the idea. Moves on. But look at all these things without going crazy about it. All of these things are at horizontal gene transfer, uptake of neutrophils where they replicate inside of a white blood cell, da-da-da-da-da. That's why we often see the gram-negative cocci inside of a white blood cell. Human to human, increasingly resistant, now being encouraged as an urgent threat. In U.S., decline since the emergence of HIV/AIDS, probably due to, and everybody's scared the living daylights out of people. But this was the big player. We basically saw this more than any of the others. Again, it was gonorrhea or not. And even the presumption was, until proven otherwise, it was gonorrhea. If it didn't respond to the typical penicillin or cephalosporins, then we started to look at other areas potentially. Still treated similarly. Okay, direct contact, almost always sexual, mother to child. Unfortunately, factors influencing incidence include birth control pills, asymptomatic infection. Vast majority. I mean, that tells you 80% of the men are symptomatic. This hurts. Anecdotally, people will tell you this is really very, very severe. And it was a lot of things that, I mean, the extraordinarily pain described as, and if you see it in certain, as though someone's going to the bathroom and razor blades are coming out. I mean, you see, there's a lot of that. There was a lot of Vietnam era vets, you know, where when they were on R&R, that was, you can imagine what the R&R was under those circumstances. So frequent, now we're seeing more resistance, combination therapies of cephalosporin and azithromycin now recommended. So you're using two usual things, no vaccine. Okay, this is the conjunctivitis. Well, required by law in the United States for all of these and applicable to all of these is that. And they have a pretty nice thing. These are a little less common. So mycoplasma, even we talked about mycoplasma being mostly walking, but there's also, we're seeing an uptake in mycoplasma, and they name it for where it occurs in genitalium. Okay, a little, you know, not easy to detect, frequently asymptomatic, very similar to the other two. No cell wall, so that limits the antibiotics that are there. Okay, a fairly long generation time, so that comes on slowly. Just like, again, think of atypical pneumonia or mycoplasmal pneumonia. It comes on slowly, stays a long time, goes away slowly. Okay, again, unprotected, maybe more common than reported because of the nature of it. It's hard to detect. The asymptomatic, at this point, not notifiable. And I don't know why. And again, when I talk about notifiable diseases, wherever you're working, it's you just have to, if it's noted, you know, you say, hey, this is notifiable. Someone's going to have to, whether it's social services, maybe they contact the health department. There's got to be, there'll be a protocol wherever you will work on what you do about this. That's, and you follow the rules. All of a sudden, your best friend comes in. Oh, please don't tell them I'm going to get in trouble. Blah 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 blah. Not your call. They're supposed to handle those things confidentiality. That's the kind of thing people lose licenses about. I can't stress it enough. I want all of you to succeed. Don't, as my dad said to me, don't blank up. I've had that discussion with my kids as well. Moving on. So as you can see, some are resistant to even azithromycin. That's the Z-Pack. You got to treat both partners. So it might be a little difficult to find something about that. Now we get into some more yucky stuff. Now we're past, these are called ulcerative diseases. I know, I'll get rid of the pictures. So ulcerative diseases are things where you can see a lesion. So, I mean, herpes and syphilis, and it's not the only one. Syphilis is the big player, and interestingly, ulcerative, meaning there's some type of sore, of breaking the integrity of the skin, something that's distinctive, and that's distinctive. I mean, and there's worse ones. In the name, I don't know how you would pronounce it. The way I would pronounce it is Schenker. Years ago, I remember my mom and dad, when you get like a cold sore in your mouth, oh, you've got a canker sore. That was the expression they would use. Maybe some of your folks said the same thing to you. But there are hard chancers and soft. These are hard, and interestingly, they're comparatively speaking painless. And then it's the old story with things that are painless. You don't, it doesn't really hurt. I don't. Let's see if it goes away, and it does. That's the big problem. After 3 weeks, it goes away. Okay, so it takes about 3 weeks. Imagine how many contacts you could have, and then after maybe 3, maybe up to 6 weeks, it disappears. And when it's disappeared, what do most people think? Out of sight, out of mind. Better. First of all, when it's open like that, it's teeming with spirochetes. Extraordinarily infected. And then when it goes away, they've gone into the bloodstream and they're traveling all over your body. That's the next phase. that, and you're extraordinarily infectious. The unique thing about this disease, until you're well into a period called latency, which we'll get into the different phases, you're always likely to infect somebody else. It is a highly infectious, often unnoticed because it's not, you can imagine. On the male, it's typically exterior, but depending on the kind of contact, in the female, frequently it is not easily recognized or seen unless identified by a partner or during an examination. And then we get into the whole thing with anal intercourse, which is obviously more frequent in gay men, and again, whatever floats your boat. Get the idea? So went away. 2 to 10 weeks later, it's going throughout your system, and now you begin to see there's typically a rash on the palms and the soles. Again, doctors, that's why we look inside the mouth. The mouth is reflective of systemic diseases. Something looks off. It's like, remember in measles, you look at those little white granules called Koplik spots. Okay, in the mouth here, you see some really funny things that are going on. It just doesn't, like, this is an awful case, obviously. But all of those things, it's almost like flu-like symptoms. You could conceivably have signs of hepatitis or renal disease, extraordinarily infectious. Then that clears up. And even though, I just got over it, was a really bad bug, I don't know where I got it. And at that point, you're still teeming with all these spirochetes. And you go into a period of latency. Not everybody. The antibodies you can easily identify by way, because you can't remember, you can't culture this. Okay? So there's no magic. You have to do it indirectly. You have to be tested for it, send it to the laboratory, do a blood test. And typically, that's how it's done. But it was so rampant, so I transferred from Lehigh University to Seton Hall University in 1970. Spring term of January 72, and I had to have, you had to have what they call a serology. That was testing for syphilis. If you did not know, up until, certainly in the state of, almost every state in the union, except I think for West Virginia and for Las Vegas, you had to have a blood test for syphilis prior to getting, they weren't going to stop you from getting married. My first marriage was in 1978. Okay, we were both tested. It was all about epidemiology. They weren't going to stop you from getting married, but they wanted to know if you had syphilis, and then the health department would get in touch with you. Well, we didn't. Okay, at that point in time. So, and when look, I don't know when it changed. I'm going to guess maybe it changed either in the 80s or the 90s. With regard to people not having it. That's why people, when they wanted to they'd go to Las Vegas to get married. From around here, they go to West Virginia because you didn't have that wait time. Now, effectively, none of the areas have any wait time that are there. So you get married right away. That was all about syphilis. So it was everywhere. We saw it constantly. People would come in, we'd take a look, we'd get an idea, we'd be able to get some tests from the lab, and then all of a sudden, okay, they'd come in and basically get the cure. And the thing is, we know we'd see them again in about 6 months. And we used a lot, because you understand you're not going to see patients coming back that willingly. What happened was we would give them, I'm not thinking myself. My daughter's texting me something I don't understand. And so we would give them 2 big shots of penicillin. The treatment was penicillin, and you give them 2 big shots in the butt, and it was a form that would be slowly released. It was like getting 2 golf balls back here. And then you give them something to keep it in the urinary tract longer. If you saw the initial presentation with that chancre or that hard sore that was there, 25% recover, 25% stay there, and then the next stage, and this can take years. We're talking 5 years, 10 years, 20 years, 30 years. And then now it's doing long-term damage to you. It can be passed on during that period of time to children. Okay, so we would see neonatal syphilis, signs of this. These are called gummas, and these gummas are chronic granulomas. It's almost like a soft spot, almost like you could take it and push. And what would happen is eventually areas like cartilage and bone would be just literally coming off. They'd be decaying. And people were losing these kinds of things. It was just horribly disfiguring. Cardiovascular. Sometimes it would go. They thought that it was a tribute to the very famous criminal Al Capone, because he kind of went crazy, and he was all sorts of women everywhere all the time. And they were pretty sure he had terminal syphilis when he died, when he was still in. And I think he was out. They released him from jail only to have him die of this shortly thereafter. Okay, and all of these are possible with it. Easily crosses the placental barrier. You get these little notches. Back in the day, and I used to have the students know this, but I don't. This was called Hutchinson's teeth, and a doctor named Hutchinson talked about something called Hutchinson's triad, and it was damage from the spirochetes on what they call solid structures, little notches in the teeth that would come out, bony deformities, like the nose would be almost flattened, the shins would come to very sharp edges, much sharper than usual, things like that, and they would all have irregular eyes. And so the pupil of the eye would look very, very irregular. And you would see this in late stage tertiary syphilis, or if during the earlier stages they had children and had crossed the placental barrier. It didn't matter if the man infected the woman, or if the woman had it initially and the man did not, it was still going to cross that barrier. That was there. Any early signs resembled adult secondary, bone, cartilage, teeth, the eye, all of the terrible. Treponema pallidum, again, just like Lyme disease, it's very a microaerophilic gram-negative spirochete. Only humans, cannot grow it in vitro. We have to use other methods. Mostly we do it indirectly with immunofluorescent techniques. And you can do a variety of more sophisticated testing today. You can see the spirochete there in the tissues. Easily penetrates, small infectious dose, multiplies in localized areas, spreads all over. You can see that initial response, 2 to 6 weeks, and then that goes away. Secondary, this is immunological in nature. Again, just like Lyme disease, it's the immune system. Spirochetes, infectious lesions occur on skin and mucous membranes. Lasts weeks to months, even a year, then subsides. Look at the period of this go away. I mean, and maybe early, and still treatable, but early in latency. Okay, you can treat it maybe into the first few years. When you get about midway, maybe 5 to 10 years in, it doesn't. Then so you can treat these from the very start, sometimes for a period of 5 to 10 years, and cure people. Not that people necessarily listen, but after that, all the antibiotics in the world won't do it. Okay, tertiary, they're no longer infectious. Good news, but the damage is done. Bad news. Almost any part of the body, skin, bones. You can just look through all of these types of things that are there. With secondary syphilis, even just through saliva, through kissing somebody, or by contact directly with a primary ulcer. Not going to graphically describe to you, but you can imagine how that might happen. Okay? All of those types of things. Okay? Antibiotics effective except tertiary. Okay? Because they have to be multiplying. It may help progression, but does not correct anything. Congenital, treating the mom before the 4th month, prenatal care. No vaccine, the usual stuff that goes along there. For years, penicillin worked extraordinarily well. We used the most basic penicillin, penicillin G. That's the one I was talking about. These 2.4. It's basically like 1.5 grams in each cheek, and this like oil base. I have no idea what they're using today, but now cephalosporins probably predominate more than anything else. I don't really do, this is another, the chancroid is odd, tropical area. This is a lymph node. And I mean, and those will open up and drain. They're very, very rare. And I don't ask questions about that, but it's something I just, for the sake of completeness, all of these, any open sore, they all increase the likelihood of additional sexually transmitted diseases. Any of those sores makes you much more predisposed to HIV, to, if you don't have gonorrhea, if you have syphilis, get gonorrhea on top of it too. Chlamydia, trichomonas vaginalis, doesn't matter. And it's, maybe people are, hopefully not as much today, are frightened about going in and have these things looked at in an emergency room. But again, they have to understand the process. I mean, it's so complex, so complex. I mean, that's why I urge you. Maybe that's a lot of the frame for these. When we start talking about diseases, don't be judgmental. Strange things happen to people all the time. Not always good. I hope that all of yours is good. It's just unlikely for all of that to be here. And see, this textbook, Nestor, classifies them first bacterial, then viral. Viral, I mean, when we the other textbook, the Cowan textbook, has always classified them, and they're both good. They classify it by how it appears. Is it a drainage disorder? Is it an ulcerative disorder? Is it something else? Okay? These are at least as common as bacterial STI. Oh, much more, but incurable. Again, the most common bacterial STD, chlamydia, then gonorrhea. As far as I'm concerned, again, because once you have HPV, have HPV, so anyways, so the number increases in the population exposed to it, which is really effectively can't get rid of. So to me, when you talk about the HPV first, interesting chlamydia nowadays, I think probably when you talk about new cases on top of pre-existing cases, new cases, chlamydia is probably the most common. It's treatable, a little bit different, but if you put a laundry list of what people came in to get checked, okay, when there's a new case or a new outbreak, finding HPV, chlamydia, kind of in that ballgame. Statistically, there's probably more chlamydia because people keep doing the same thing over again. Human behavior is somewhat predictable in that regard. Well, let's see. At least as common as bacterial STIs, but incurable. Mm-hmm. Okay. Effects can be severe and long lasting. Okay. Genital herpes can recur for years, whatever. HPV, we know, leads to cancer. Untreated HIV, we'll get into all of these. Herpetic, these are ulcerative. They are. The interesting thing is, and this is typically herpes simplex type 2 or HHV2. When we looked at, remember that we did viruses? The reality is that usually the worst outbreak is the first outbreak. After that, the recurrences are not nearly as painful or severe. That's typically what occurs with, and the vast majority are herpes simplex virus type 2, what we call genital herpes. And really, it's more, and again, with a big problem with it, is this is damaging the barrier, not just the painfulness or what it appears like, and the scariness of the way it looks, so to speak. But where the big problem is the barrier. And now the barrier is compromised. And guess, once you got it for good. It can always recur. Will it always recur? No. Itching, burning. And again, a lot of times in the female, they're not visible. They're internal, comparatively speaking. They're just not on the external genitalia as visible. Little bumps, depending on the area, the site of infection, blisters, dry and crust, and then they kind of go away. We don't see the discharge typically. We don't typically see a lot of this stuff. The painfulness of it, or the irritation, the inflammation is there, but it's not necessarily, there's not, distinctive drainage or distinctive color or distinctiveness about the discharge. Couple of weeks, recurrences are common, but usually less severe. That's very true. And thankfully, we finally have something to treat it with, but it doesn't work to prevent it. And that's, I went into that before with antivirals, Valtrex, acyclovirs. The good part about them is just that. They are very effective at treating outbreaks when it reoccurs, and they're even effective in limited doses preventing recurrent outbreaks. I don't know what the current pharmacology is and how, whether it's a family doctor or whoever would be treating a person for this would go about using it. Usually HSV2, it doesn't preclude HSV1 because, again, depending on the kind of contact, herpes viruses, oral can be genital, genital can be oral. Usually the case causes more severe genital lesions with greater frequency of recurrence. Again, blisters that are there, ulcerations that are painful. That's a stat. This is 8 years ago. So what is that? 10% of the population 8 years ago? With maybe that was maybe. I'm trying to figure out. I don't even think we have 450 million people in this country now. So let's say at least 10%, 500,000 cases each year, new ones. Okay. So, and again, these don't have to be visible when it's, oh, it went away, doesn't mean you're not transmissible, that you can't infect somebody. Oh, it's not there, it doesn't mean you can't. It could be just coming out or just going away or be there. And frankly, a lot of people are going to do what they're going to do anyway. Okay, that's an interesting number. Individual forever at risk of transmitting. Ulceration increases risk of HIV infection. Again, any of these things do. Again, I would be less concerned about it surviving on inanimate objects. This is very rare. It's human, that type of thing, not curative. All of these, again, the acyclovir family has been very useful. Okay. There are certain spermicidal agents that inactivate it. This is true also for genital warts, and it's true for a lot of situations that are there. It doesn't necessarily cover the area. So, I mean, it's just, it's a problem in that regard. This is the big one. This is why, this is really one of the scariest things with why prenatal testing is so important. If it's the first attack and the mom has not been, if they recognize that this was the first herpes, there is an extraordinarily high incidence rate of significant, possibly lethal damage to the baby. They can get herpetic encephalitis during the passage through the birth canal. Those babies have to be delivered by C-section. If it's treated, different story. But if it's not treated, there are some scary pictures you can look at online with herpes encephalitis, okay, herpes meningitis from passage through the birth canal in a newborn. It will, you'd be frightened to death to even think about that. Primary infection, first one, 30% risk of acquiring the infection, dies or disabled, absolutely true, must be delivered by C-section, much lower with recurrent. That first one is unusual in that regard. And so you can look through these. I'm not going to sit here and read it to you in the time. That's not a pleasant picture. But we'll let you think about that, and we'll come back and look at it next time. Hard one, isn't it? It's pretty yucky stuff.